Hello and welcome to Inside CRCAIH. I'm DenYelle Kenyon, filling in for host Melissa Buffalo. Today I have with me Dr. Marylou Mylant, a 2014 CRCAIH Pilot Grant awardee. Dr. Mylant's project was American Indian pilot study on caregiving attachment and health of young children. She's a professor in the College of Nursing at South Dakota State University. Welcome, Marylou, and thank you for joining us today.
Well, thanks.
Great. So just to start off, why don't you tell us a little bit about yourself and your background?
Well, I was counting the years yesterday or this morning. Started off as a pediatric nurse, and that was 42 years ago.
Mm-hmm.
So children have always been a real focus in my life, and so I started off as a pediatric nurse, and then changed my focus to look more at child mental health, and that's where I'm at.
Great. When did you join the SDSU and take that track?
1992. So,
okay.
And looking more at doing research and also staying clinically involved.
Wonderful. And this is a great way to blend those two interests.
It is.
Sure.
It is.
Great. Well, why did you choose this particular topic for your pilot grant project?
That probably was one of the reasons, was that we were involved with working with the school who didn't have a school nurse at the time. So finishing doing some of the data collection and screening with the children and the adolescents of all ages. And then we identified that the school themselves, were concerned about lack of engagement for the preschoolers. The preschool was just developed by the school for just over 3 years at the time. And while doing the screening of the preschoolers, we also saw that there was a high rate of overweight and obesity in that population, and so really saw the need for prevention and probably targeting that younger age group.
Great. How did you find the Strengthening Families program? How did you settle on that program?
Well, in just seeing that, I had heard about it before, knew about it, but saw that it had been adapted successfully to American Indian communities, and it was evidence-based, supported by SAMHSA, and so that really, settled why we settled on it.
Great, good. And so can you tell us a little bit of the future directions for your research?
The future direction is really going back to meeting the needs of that community and possibly moving on to looking at a program that would help the community themselves deal with historical trauma, and then meeting their needs as parents and caregivers before going on to launching a parenting program, and considering something that's more community-based and looking at the community strengths that are already there.
Fabulous. Well, good luck with your future program and research, and thank you once again, Dr. Mylant, for the work that you do and taking time to visit with us today and present. If you'd like to learn more about Dr. Mylant's research, we will have her Pilot Grant Seminar Series full hour-long length talk on our website, www.crcaih.org. And her presentation, a smaller version of that, at our last summit, 2016. And thanks again for joining us. And Melissa, I hope I did a good job filling in your shoes, and have a great day.